You have diarrhea and you are looking for the best way or ways to treat acute diarrhea. If that is your goal, you're in the right place. Without further ado, let's go. Hi everyone, I want to talk about acute diarrhea treatment, and that will be lesson 3. It will be advisable that for you to enjoy this lesson 3, please kindly go over lessons 1 and 2. You can check my channel for acute diarrhea lesson 1. That will be about different types of diarrhea and causative agents. You can check also acute diarrhea 2. That will be about symptoms and diagnosis of acute diarrhea. Now, it's about the treatment of acute diarrhea. Okay, let's go. The first thing to do is to inform the public health. Report outbreak of infection to the public health authority. The treatment will begin with history, because with good history and appropriate physical examination, you might be able to determine the exact cause even without radiological or laboratory investigations. You'll be able to determine the severity of the symptoms and the level of dehydration. We should admit the affected individuals if they are feeling weak or dizzy. Those are pointing to hypovolemic situation that may lead to hypovolemic shock. You can give intravenous fluid in form of normal saline or Ringer's lactate. You start with normal saline 1 to 2 liters immediately, and you have maintenance. You should be able to check the vital signs, and you give more IV fluid, normal saline, if the blood pressure is still low. You should have bladder catheterization because this individual may not be going up and down to pee. You treat associated infection if you're able to pick one. Treatment still continues. You can use disease-modifying anti-rheumatic drugs with steroids if the situation is pointing to inflammatory bowel disease, ulcerative colitis, or Crohn's disease. You may be able to use antibiotics, but ironically, some of these acute diarrhea situations are actually caused by the use of antibiotics, but that is not to say we will never use antibiotics anymore. Okay, like Clostridium difficile, formerly known as Clostridium difficile, is actually secondary to antibiotics usage. So you can use metronidazole, azithromycin, tetracycline, but depending on the age, you may not be able to use tetracycline in younger age group. And fluoroquinolones, you're not going to use that in breastfeeding mothers, pregnant mothers, and children younger than 8 years old as well. You are free to use loperamide, but be careful you don't use that in infectious situations. So if you are sure there's no infection here, then you can start your loperamide. You can use bismuth salicylate, but be careful in children because of possibility of aspirin toxicity, and not even in individual taking aspirin for other reasons. And Reye syndrome is going to be there if it's used in children. Note: parasite could be tested for microscopically and use of antigen detecting methods. Molecular testing is possible, and you have CD4 count in HIV. Sugar toxin producing Escherichia coli is a serious issue. STEC, and I'll talk about that more in a bit. ORT or ORS, how do I mean? OR is the oral rehydration therapy, some people will call oral rehydration solution. In that case, you will rehydrate through per oral, okay, not intravenously, just per oral. And examples of already made oral rehydration solutions are Pedialyte, Gastrolite, Ceralite, and Rehydralite. Or you can make your own at home, self-made with water, salt, and sugar. If the illness is mild, then use the above. Okay? If there's no weakness, dizziness, tiredness, and the level of dehydration is about 5% or below, you are free to do that. Okay? You can also use that with diluted fruit juice or with flavored soft drink or with salty crackers or with broths or soups. You can do that. And that's what majority will actually have. Other oral rehydration solution examples are Gatorade. That will be enough for sweat replacement and for sport people, right? But not good enough for diarrhea except very, very mild cases. Okay? Then you switch over to oral rehydration solution after you have resuscitated the individual with enough fluid intravenously. Okay, then you can give foods like cereals, potatoes, noodles, rice, wheat, oats, crackers, banana, soup, and boiled vegetables. They are good for people with diarrhea. What are the indications for antibiotics in diarrhea? It's not a routine stuff to do. Okay, you just don't give it. If you are pretty sure that this is viral in origin, you don't give it. No antibiotics. But we have to explain that to the affected individual. Acute diarrhea is short-lived, so no need of antibiotics here. But antibiotics is good for severe diarrhea with fever or stooling greater than 6 times per day or severely dehydrated individual that needs hospitalization. Also, antibiotics will be good if there's a case of bloody diarrhea, mucus stained, elderly, individuals with low immunity, people with concomitant cardiovascular disease, pregnant women with fever and diarrhea will need coverage with antibiotics. Note this, it is wise to have stool tests for sugar toxin producing E. coli. You know, I just talked about these in the last 4 minutes, and I made promise that I'll talk about that in a bit. So here is the point now. So there is sugar toxin producing Escherichia coli, and if we don't rule out that before giving antibiotics, that would lead to hemolytic uremic syndrome, most likely. So hemolytic uremic syndrome from treating sugar toxin producing E. coli is more of children problem than adults as far as antibiotics treatment is concerned. So all those wonderful young boys and girls coming down with diarrhea and you are suspicious that this is likely going to be caused by infectious agent, bacteria in particular, then it would be wise if your center is having the facility to do that, to have sugar toxin assay. So, a febrile patient with bloody diarrhea and outbreak, we should suspect sugar toxin producing E. coli, and we should get that lab results before we give antibiotics. Okay? As my opinion, it depends on what your gastroenterologist will want at your jurisdiction, but it's going to be better to save the entire family and the young man or young woman in pediatric age group from the effect of coming down with hemolytic uremic syndrome secondary to your health. Okay, so we have a lot of antibiotics to choose from, but we're going to choose wisely. So we can choose azithromycin. That would be good for almost everybody across the board, for pediatric age group, for pregnant women, elderly, everyone. Fluoroquinolones are pretty good, particularly ciprofloxacin, levofloxacin, and norfloxacin. And you know what? It's not everyone that could take this. So pregnant women are exempted from fluoroquinolones. Breastfeeding mothers should not take it. Children less than 8 years should not take fluoroquinolones. If you are going to choose loperamide because you are sure it is not infectious, we're going to use it in people that are not having diarrhea with fever and their diarrhea with stool that is not blood or mucus stain. In other words, non-bacterial related, so not in dysentery. We're not going to give loperamide in dysentery. And when we give loperamide, it's not going to be for a long time. It's okay for 1 day or 1.5 days. It's not what we're going to use for a long period of time. And we are not going to give loperamide if there's associated fever, blood stain, or mucus. No loperamide, please. That is Imodium. Somebody asking me, what's he talking about? Loperamide. That is Imodium. So Imodium is not for everybody, please. Pepto-Bismol is fine. You can give 30 minutes or 2 times every 30 minutes, and you give 8 doses like that. But be careful with aspirin, or else you'll be double dosing. And you know the implication of that. You can check my channel on aspirin. I've published detailed information on aspirin before. You can add loperamide to antibiotics. That will have a kind of synergistic effect. No loperamide at all in dysentery with fever, but you can use bismuth subsalicylate. However, be careful with aspirin, like I've said, and also be careful when you're using your Pepto-Bismol in children because it can come down with dry syndrome. I will not give Pepto-Bismol to all pregnant women and children. No, it's personal opinion, just to be at peace. There are other meds that I've never used, but that does not mean I will not supply the info. Okay, so resveratrol is an encephalitis inhibitor, and some use probiotics like lactobacillus rerin and useful in childhood infectious diarrhea. Saccharomyces boulardii can lower the duration of Clostridium difficile infections. I've never used any of these, like I've said, but you have the info that some can use them, and just find out from your gastroenterologist or follow the protocol at the center where you're working or the jurisdiction under which you are serving. Follow up, just like in any other health related issues, follow up is very important, but not in this case. You don't need to have post treatment stool testing. However, and I want you to please get it clear right now, if you are dealing with health workers and the individual has come down with diarrhea, or food handlers and he or she has come down with diarrhea and your diagnosis is either STEC, that is Shiga toxin E. coli, or Salmonella, and even if it is Shigella. So in those 3 cases, please, we have to do post-treatment stool testing. Otherwise, there's no need for post-treatment testing. And with that, I've come to the end of 3 video presentations on acute diarrhea. I'll be working on chronic diarrhea pieces of info very soon. Kindly subscribe to my channel so that you can get these presentations immediately they're published. Thank you. I appreciate it.